Thank you for your interest in our efforts to develop ecosystems for healthy lifestyle. My name is Michael O'Donnell, and I will be focusing in this short presentation on our approach to doing this. And we see three critical prerequisites. The first one is we need to deliver a therapeutic dose of evidence-based approaches. We also need this to be fiscally self-sustaining, and we need to be able to scale this to address state level and national level problems. So what is a therapeutic dose? It's an exposure that's sufficient to make an impact, and that includes the intensity, the frequency, the amount of time that lapses, and the ubiquity, being present in all places. So we really need to move beyond the superficial, intermittent, ineffective programs to create entire ecosystems. So what is an ecosystem? It's people interacting with complex environments. And our goal is to create healthy ecosystems in all the spheres that people encounter so that we can reach all people all the time. So this idea of an ecosystem is really very important because we know ecosystems impact people's behavior, their lifestyle, and we also know that they directly impact people's health. And this process is by impacting health conditions, which then lead to diseases. So it's also important to recognize that lifestyle then impacts health, and that lifestyle can be an antidote to a toxic ecosystem, but it's really hard to resist that ecosystem. So looking at this from the perspective of obesity, the ecosystem in which most people in the United States live is that we have engineered activity out of daily life, and the food has been engineered to be addictive, to be low priced, packed with calories, and nutrients really not a priority. So the impact on this on lifestyle is that physical activity for our population is basically low, and the food we consume is high calorie and low nutrient. The result is we have prevalence of obesity, which leads to diabetes, heart disease, stroke, some cancers, gallbladder disease, osteoarthritis, depression and anxiety, and other diseases. So let's take a look at this from the perspective of the United States. And we see on the left the prevalence of obesity back in 1994. The darker colors tend to be the more prevalent levels of obesity in states like Indiana. And then there's diabetes on the map on the right. And let's take a look at what has happened over time. We have seen obesity increase in virtually every state. And a couple years later, we see an increase in diabetes. And the only good news here is that Colorado still is the least obese state and also has the lowest level of diabetes. So what does a healthy ecosystem look like? We'll look at this in workplace, school, and hospital settings. One of the keys is we have to recognize that education is not enough. We need to improve people's awareness of the link between lifestyle and health. We need to figure out how to enhance motivation to change behaviors that'll lead to good health. We need to build skills on how to change these habits and practice new habits. And we have to create opportunities to make it easy to practice these new habits. We need to provide a therapeutic dose. So what does this look like in workplaces? A critical starting point is that leaders and coworkers need to support healthy lifestyle practices, and we need to incentivize people to practice healthy lifestyles. We also need to train them in skills like fitness, nutrition, stress management, weight control, quitting smoking, medical self-care, and then we have to give people the opportunities to practice these healthy lifestyles. Now, something that we are recommending to be added is that employers also invest in the health of their communities, including in schools, because this is necessary to reach spouses and the dependent children who don't come to work. So in terms of hospitals, the healthy hospital ecosystem, it starts with being a healthy workplace system. Same basic principles as any workplace, but we also need to integrate lifestyle medicine into patient care. And we are encouraging hospitals to start allocating a portion of the community benefit dollar requirements that are necessary for nonprofit hospitals to healthy lifestyle in their communities, including schools. And healthy ecosystem in schools start with the base of being a healthy workplace for all of the staff and employees. We also have to recognize that the key of schools is to educate young people. So the teachers need to role model healthy lifestyles for students, and we have to adapt some of the skill training programs, especially for tobacco. The goal is to avoid quitting tobacco. We also, in terms of opportunities, in addition to being physically active, opportunities and eating nutritious food and breathing tobacco-free air, we have to make sure that students feel safe and valued and that they're in a nurturing environment that helps them learn. We also need to recognize that young people are just still developing from a social, intellectual, emotional, and spiritual perspective. So it's not just the physical health that we need to focus on. Now, the second element that's a prerequisite for being effective, what we're doing needs to be fiscally self-sustaining. So the current norm is that foundations fund programs and governments fund programs, and the programs last as long as these funding sources continue. So our aspiration is to gain seed funding from foundations, but to use that seed funding to mobilize other resources that would multiply the investments in the foundation's current priorities. We also want to repay the foundation for the seed funding. We also want to eliminate the need for government funding for programs by mobilizing new resources that will stimulate economic development through investments in creating healthy lifestyles, healthy ecosystems. So our projection is that this would actually increase state and federal tax revenues. Now, how do we mobilize the necessary resources? We create a mobilizing organization that mobilizes financial resources, social capital, intellectual capital, and policy support for these efforts. So in Colorado, this organization would consist of 10 people whose full-time job is just mobilizing all the critical stakeholders. There would be 5 more people whose job was mobilizing policy support, and 5 more people to mobilize best practice strategies used among health promotion providers, employers, clinicians, health plans, and stimulate innovation and enhancement. And then a couple people to mobilize campaigns and also evaluate and disseminate. Now, how do we mobilize these other resources? The first step is to do a resources benefits matrix analysis in which we ask who has the resources and who benefits. So, for example, in Colorado, we estimate that we need $250 per person per year to be mobilized, which works out to just under $1.4 billion a year for the 5.5 million Coloradans. And for the United States, this works out to about $80 billion a year for 320 million Americans. And this is a very simple, fast description. I encourage you to look at our website for a detailed description, but it would look something like this, where most of the contributions actually come from large employers because they've got the resources, they've got the cash, but more importantly, they have a financial benefit to invest in the health of their employees because they need to save money on medical spending. They also want to enhance the productivity of their employees. And they've got the resources. For example, they're already spending the $250 per person per year is less than 4% of what they're already spending on medical coverage. And at the national level, the 80 billion we need is 0.3% of the $22 trillion in cash they have on hand. Health plans can also contribute. Medicare covers a lot of these programs. Hospitals, small employers, and individuals are also groups that are likely to support. Now, what this would look like with the sources of funding across the top and the donations, the source of the application of the funding at the bottom, I'll describe this very briefly. Again, see our website for more details. Most of the funding would come from employers, and most of that funding would go right back to those employers to support their employees. But to reach the spouses and the kids, we need to reach out to community level organizations represented here. Also, we envision a tobacco tax, which would support the nonprofit organizations as well as community coalitions. Also, health plans, a lot of that money going back to supporting their own individual health plan members, and then also the small businesses that they fully insure, and some money going to the community as well. Medicare and Medicaid would fund actual clinical programs, most of which would be provided by hospitals and other clinics, but also by some community programs, like the Y has a large diabetes prevention program. And then hospitals, we see contributing some of their community benefits dollars. We haven't figured out the details there. So how do we become fiscally self-sustaining? Number one, we see employers, health plans, hospitals, Medicare, and individuals funding the creation of healthy ecosystems, not foundations or governments. Number two, we envision creating a buyers coalition that captures 1% of the flow of the new investments that are needed to support, and this dollars would be support the mobilizing organization and repay the foundation seed funding. So it's not just the financial capital that we need to mobilize. We need social capital to engage people, and large employers, small employers, and schools are probably the ones that have the greatest source of social capital and will benefit from mobilizing. Similarly, we need to mobilize intellectual capital to develop these programs, and the health promotion providers are really uniquely qualified here. And we need tax and policy authority, which will come from state governments and local governments. Now, our timetable, we've been studying this starting in 2017. We started sharing it in 2018. In 2019, we really have shifted our focus from this idea of universal access to health promotion to ecosystems for healthy lifestyle. And we're in the friend and fundraising stage now. We hope to raise funding for a pilot in 2020, and then an expanded rollout, if this works well, in 21 to 2031, over a decade. Now, the final prerequisite for this being effective is to be able to scale these strategies to address state and national level problems. We know this works for individuals. We know this works for employers. The question is, can we make it work for an entire community or entire sector of Colorado? And then if yes, how do we expand to all sectors of all communities? So this is the approach that we have been developing with 11 of our advisory board members, and collectively, we have several centuries of experience in improving health by harnessing the lifestyle as medicine approach in clinical, corporate, community, policy, entrepreneurial, and academic settings. And equally important, we are parents and grandparents and aunts and uncles and neighbors of all the children of Colorado. And our goal is to give them the best opportunity to achieve their dreams by having good health to do that. So I encourage you to take a look at our website, ecosystemsforhealthylifestyle.com. It has this presentation on our approach, but also the problem and our proposed solution, as well as more in-depth presentation on all the details. And there's a white paper and there's a way to get involved in what we're doing. And we need help. We need help in refining our approach and sharing it with others, and in raising funding for our pilot study. So we look forward to working with you.